Hello and welcome to this special show on Rajya Sabha television where we take a stock of India's battle against COVID-19 pandemic. Now, the government has extended the Unlock 5.0 guidelines up till 30th of November. These are going to be very crucial months, that is the month of November and December, because the festive season starts from the October month and extends up till the end of December, wherein we will see a lot more gathering of people as well as, intermingling also. So the big question here is how to go ahead and celebrate festivals during pandemic. And since we're in the middle of COVID-19 pandemic, this becomes really important to take a look at what all precautions we need to adhere to and what more can be done to ensure that we can contain the infection or the spread of COVID-19 further. For more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Urvashi Prasad, the Public Policy Specialist in Health at Niti Aayog. We also have with us Dr. Rohit Sarin, member of the National Task Force for COVID-19, and Dr. Madhu Gupta from the Department of Community Medicine and School of Public Health at PGIMER, Chandigarh. Welcome, all of you, to Rajya Sabha television. Let me begin with you, Dr. Sarin, and let's look at all those guidelines and all those aspects in terms of a sort of a refresher for, jogging the memory as far as ensuring good navigation through the festive season in the coming weeks or months, specifically now that we are in the middle of the pandemic.
Thank you so much for having me on the show. I think it's very clear that we have to be back to the basics, you see, as far as the special COVID-19 infection is concerned. And the basics relate to primarily three events. One is, of course, we have to learn to continue washing our hands as frequently as possible and do it the right way, so that we go into the crevices of the hand, we go into the palms of the hand, and the nails, the thumbs, the wrist, all that. And it takes some time. I mean, about 20 seconds, 30 seconds for all these, procedures to take place. So that is something which each one of us has to continue doing. I still remember, you see, when we were children, we were asked to always wash our hands very frequently. And I think the same is true even now. Okay. The second part is, wearing a mask. There are different types of masks which are available. And I would say that for the general community at large, a cloth mask would suffice. However, for healthcare professionals, there are again surgical or medical masks, and then there are N95 masks, which are to be worn during certain conditions and certain specific situations. And then, of course, we have to maintain some sort of distancing. जैसे कि प्रधानमंत्री जी ने भी कहा, 2 गज की दूरी बहुत है जरूरी. So at least 6 feet distance has to be maintained. Make an effort at that. Okay. I will put it like this. Okay. And, in addition to these three, I think there are certain other basic issues which we have to continue following. And they are, avoid going outside, especially if, you are coming in the 60 plus age group or 10 minus age group. This is something which we have to be very cautious about. If we have to, take care of our usual day-to-day needs. And then if there is someone younger in the family, that individual could go out rather than, the elderly person. So that's again something which is very common, which we must adhere to.
Okay. Those are definitely, significant points there to try and ensure that we go ahead and practice those good habits. But let me bring in Dr. Madhu here as well. Dr. Madhu, from a public health expert's perspective, we keep on saying this, and the government guidelines also point out in terms of how crucial the festive season is and the coming weeks will be. But what are the, danger areas? What are the prone specifications or areas wherein we tend to go wrong there during this particular season or during these particular weeks and months?
At the outset, thank you for inviting me here. And that's a very pertinent question. And especially we Indians are very emotional about our festivals. And it is very difficult for us to stay inside during the festivals. And this also I'm talking about myself. So, dear Indians, I appeal, please do stay at home this year. So next year, hopefully, we will have vaccine and we will hopefully be safe. Then please celebrate as much as you want. But this year, please follow the restrictions very, very cautiously. We are still in the danger zone,
Mhm.
especially in the containment areas. No festivities as per the guidelines of the Ministry of Health and Family Welfare. So please celebrate inside the home. And believe me, God will not be angry at you. He will be rather happy with you. So, and you can stay at home and you can celebrate within your home with your family very nicely, especially in the containment zones. And also, these guidelines talk about if you really want to like have some types of exhibitions or pandals, there are guidelines. For
Mhm.
example, if there's a capacity of about 100, then you have to call only 50 people in those pandals. There should be thermal scanning, especially at the entry. Entry and exit should be separate, and the thermal scanner should be there, and you should have sanitizers there or the hand washing facility there, and only asymptomatic person should be allowed inside those pandals or
Mhm.
those areas. And also, there has to be social distancing, which Dr. Sarin is also mentioning by way of markings where people should be standing. And if there is any symptomatic person, then isolation room should be set up and they should be accordingly, risk assessment should be done, and that case should be properly informed as per the laid out guidelines.
Okay.
So, yeah, so this is, I mean, this is the message. So, guidelines are already there, how you can celebrate. But what I would like to hear add that those who are 65 years and above, patients with comorbidities, pregnant women, and children less than 10 years, please do not go outside. Let's celebrate festivals at home.
Okay, okay. That is really, really significant, as Dr. Madhu is pointing out. Celebrating festivals at home, a difficult choice, a tough one if you look at that ways, but then we're faced with difficult times. Let me bring in Urvashi here. Urvashi, if you look at the data, then, we seem to have learned it by now how and sort of an over ambitious approach during festival season or even a slight flouting of these norms or guidelines can come back to haunt us in terms of a surge in the cases. And a good example is the state of Kerala. Post the Onam festivities, we saw the numbers going up there. So that seemingly must be a sort of a clear indication for everyone involved, both the policymakers as well as for the general public, that this is not something which we can take lightly.
Yes, I mean, of course, we have the festivals, but then, we are also moving into winter. We are also having deteriorating air quality in many areas. In Delhi, this is particularly becoming an issue now. We have wedding season coming up. So we have many factors, which are sort of all coming together.
Mm-hmm.
And that is why the sort of heightened, appeal from the Prime Minister, from the government, and also the efforts, really requesting and urging citizens to exercise extra caution at this time, because we've seen, of course, Kerala is a good example closer home, what happened after Onam, etc. And of course, there's few other factors there as well, but Onam was an important one. And of course, we are seeing what's happening in Europe and in the US with the second and third waves, or whatever we might like to call them. So we are still very susceptible, even though we are different from these countries. Obviously, our demographics are different, etc. But we are still susceptible, and that's the main message that has tried to go out the last few weeks, in particular from the highest levels in the government as well. And I think this also brings the need for the public health system to also be additionally cautious, because no matter how much we urge people, we can expect some slippages to happen in a country as large and diverse as India. So in that case, we need to be very sharp, with our contact tracing. If somebody has been in a gathering or has been in a setting where they were exposed to multiple people, and they actually end up being infected, the system needs to be very geared up to trace those people, to test them. Otherwise, we could end up, with a very difficult situation. And I think even on the hospital side, we need to kind of gear up much more strongly because, as I said, there might be other illnesses now which are also coming in. So we might see, different kinds of illnesses also getting combined with COVID at this time in particular, a lot of respiratory issues that people start to face in cities like Delhi and elsewhere. So I think it's really a time for both the health system as well as, of course, citizens at large to sort of gear up for these rather tricky and crucial few weeks ahead.
Okay, definitely. It's not only about the general public, but also the health professionals and the overall health system, which needs to, stay on top of the situation here. But one point which you brought out, Urvashi, and I'd like to put that across to both Dr. Sarin and Dr. Madhu one by one. First, Dr. Sarin, it's not only about this being a festival season; it's also the winter months, and the temperature starts dipping now. Also, in some parts of the country, specifically if you look at the capital and the nearby areas, air pollution seemingly is also a problem. So it's a compounding effect which we are looking at.
Yes, definitely. You see, there are two things which happen during this part of the year. And both these things are detrimental to the transmission risks for COVID. As far as air pollution is concerned, we are very clear that it happens every year in Delhi. All efforts are taken to reduce it. But yes, air quality is bad. Even today, the air quality is not good. So therefore, this not only will increase the risk for getting the infection, but there are other illnesses which also get aggravated during this time. And along with COVID, you see the comorbidity in these illnesses, when we talk about chronic bronchitis, when we talk about asthma, these illnesses will have a much more profound effect on the individual. So the effects of this virus are also going to be more, aggressive in nature. And because of that, I would say that the hospital settings have to be geared up to take care of that situation.
Okay, and are we all geared up in that way in terms of the entire public health system there, as Urvashi was pointing out, because obviously there might be one or two slippages somewhere, but then the health system needs to stay on top of it. So are we prepared completely? Because we've spent almost 7 to 8 months now in the pandemic. We know a lot more about the virus now. Our responses have been dynamic about it, and we're learning from the data which we're getting not only from different states but also from other countries. So is that enough to keep us on our toes?
Yes, and you see, I will also add to what you said that when we talk of getting the health system in order, in fact, you see, the lockdowns have helped to that extent that the number of beds for such a group of patients has been increased. We also find that ventilators and other equipments which are required to take care has increased. And not only marginal increase, this increase has been happening many-fold, with the result that I would say that I'm reasonably comfortable with whatever the health system has to deal with this particular problem if it rises. Okay. However, our effort has to be there on preventing, the transmission. Our effort has to continue being there, because if we let loose, then, as I said, the comorbidity and mortality as a consequence of that will be really very severe. And in spite of all our health facilities being in order, it will be a challenge.
Okay, definitely. The focus has to be on the preventive mechanism and the steps which need to be taken to go ahead and prevent further spread of COVID-19. But let me bring in Dr. Madhu here as well on those two aspects. Dr. Madhu, winter season as well as air pollution in some parts of the country being a problem area there, the compounding effect and how to deal with it.
Yeah, that's very right. I think most of the answer has been already answered by Dr. Sarin. I would like to add here, we have certain, this is a season also for influenza. So, and already there's a proven vaccine for that. So, if that can also be made use of, then we can prevent certain morbidities related to that. And there are guidelines of health ministry on giving the influenza vaccine to the healthcare workers. So, similarly, we can also think of giving this vaccine to those more than 60 years and above because they are at a higher risk. But by doing that, we can prevent some mortality. And there is also evidence that influenza and COVID-19 coexist. So they may coexist. So that is one another strategy which we have. So as Dr. Sarin has already mentioned that the advantage of COVID-19 preparation was that the district level hospitals, they are now quite well equipped. Earlier, like in PGI, we used to have referral from all over the neighboring states. But for these 5-6 months, we our OPD is almost like virtually non-functional, and they are managing all these cases on their own. So we are dealing with only COVID-19 positive cases. So this is one pointer that the district hospitals have actually strengthened during COVID-19. So this, I would say, a blessing in disguise. So that district hospitals are taking care of their sick patients. So we are going to start this OPD soon in PGI. Now that we have taken already made policy that how we are going to start this OPD, and we will ensure that we are prepared to take care of all the additional cases which are going to come during winters. Another important point which I would like to highlight here regarding air pollution. Although air pollution is increasing, but there are evidences that shows that wearing masks can prevent the ill effects of air pollution. So this needs to be investigated further. So wearing mask has dual advantage. So decreasing the infection due to COVID-19 as well as decreasing the ill effects of air pollution as well.
Okay, definitely. There it is, killing two birds with the same stone as far as, use of face mask is concerned. It helps not only against COVID-19, but also against air pollution, and people living in the national capital and the nearby areas would definitely vouch for that. Let me bring in Urvashi back here. Urvashi, I remember, we having this conversation on this platform a number of times about how the public healthcare system needs to be, given a boost, and then also realizing that in the past 7 to 8 months, how our responses have, resulted in the public healthcare system also retuning itself to the requirements of the COVID-19 pandemic. And as Dr. Sarin and Dr. Madhu were also pointing out, I hope, you would agree there that these particular tough times have given that fillip to the public health system, and we've sort of been able to retune ourselves to fight the pandemic situation here.
Yes, absolutely. I mean, I think, and we've discussed this before as well. When we look at the public health system, there are some challenges which have, of course, been very long-standing challenges and would perhaps require, longer time frame as well to address in their entirety. Again, given that we're a very large country, we're a very diverse country, and we're a federal structure. So everything is not controlled from, just one place, but it's very diverse and decentralized. But I think in the last few months, given that we were faced with an unprecedented crisis, and the world was faced with an unprecedented crisis, actually, we've seen some of the best public health systems in the world face quite a difficult time, in tackling this disease, simply because it's something so unknown for all of us. So I think we have done a commendable job, and all the stakeholders involved in this and gearing up the health system. And of course, the center-state partnership has been very important. And I think that's what will also serve us well in this crucial phase. The center has already been sending teams to a few of the high burden states currently, and I'm sure that engagement process will continue because ultimately we will need to develop strategies at the state and district levels to how do we really tackle the present situation, because we're not going to have a one size fits all, as we know that doesn't work in a country like India. So I think that's going to be the approach, and what will help us is, of course, all the boosting of the health infrastructure we've done, but most importantly, the clinical management experience. And I think the health minister of Kerala was also pointing this out on one of your earlier shows, that by now, clinicians in the health system, public health practitioners have also gained that much more experience on, how do you tackle this situation, which was a completely unknown one back in February or March. So I
Okay.
think we've done a good job on that. But yes, we need to remain very cautious for this crucial phase ahead.
Okay, definitely. We've done a lot, but we need to stay cautious, stay on top of it. And before we bring this discussion to an end, I request once again Dr. Sarin to, assess or rather sort of, review those three steps, those three important tenets of fighting against the COVID-19 infection. If you could tell our viewers once again, Dr. Sarin, about, how to go about in terms of washing your hands, wearing a face mask and maintaining physical social distancing.
Well, I think washing hands is very clearly a process involving about 10 steps. And the best thing to do is, if you have soap and water, that's the best thing. But in certain situations, if you do not have water, you could use a sanitizer. So, but the preferred option here is soap and water. And you will, wet your hands, put a little soap on your hands, and then rub it like this. And then go into the crevices like this, then the back of the hand, both hands, then the fingernails, the thumb, the crevices, the wrist. So, I mean, this is the process of proper hand washing, which will have to be followed. And when you wear a mask, please be careful that you cover both the mouth as well as the nose. The mask should not be, you find so often that people will just cover the lips and the nose is bare. Or you will find that when they are covering the mask, if they have to speak, they will lift up their masks and speak. Those things one has to avoid, because speaking also leads to transmission of the virus. It leads to throwing out of the droplets into the environment, which may carry the virus. So when one is speaking, then also one should continue having the mask.
Okay.
Limit your going out, as has been told by Madhu very clearly, and also Urvashi has stressed on it. And those who are elderly, those who have other comorbid conditions, they have to be all the more cautious, because if they have the infection or get the infection, then the effects of this infection are going to be much more severe, and loss to life will increase. So please, if you are having any other comorbid conditions, take care of yourself more carefully, and also address your comorbid conditions more vigorously, because your symptoms will be more, so you need to treat them more effectively.
Okay. There it is. Thank you so much, Dr. Sarin, Dr. Madhu, as well as Urvashi, for sharing your views with us and our viewers on this very important aspect, that is how to go ahead and navigate the festive season during the pandemic. And we will once again want to remind our viewers those three important aspects of COVID-appropriate behavior. One is to wear your face mask, and as our panelists explained it to you, the way you need to wear it entirely on your mouth as well as nose. Wash your hands as well, as explained by our panelist, and maintain social distancing, that is physical distancing of at least 6 feet. Now, these are three simple steps which you can take to prevent the spread of infection to your near and dear ones as well as yourself. This is all we have in this particular episode of India Fights Back. We'll come back again tomorrow with a different topic. But till then, keep watching Rajya Sabha television. And please do not forget to adhere to all those points which have been mentioned by the experts. And during the festive season, try and avoid going out of your house specifically to the crowded areas if you can. Thank you.